If you follow me for a while, you know I try to bring you information you need to know. I originally started this blog to help senior citizens learn to use technology to improve and better their lives. This time around, however, with the novel coronavirus, or COVID-19 as it's known, pandemic worsening, I wanted to use my platform to share with you the latest information on the virus and how to protect yourself. I'm doing this now because many of my followers and viewers fit into the category of the most vulnerable people. Now, a few caveats. I'm not a doctor or a medical professional. I'm a video producer. I'm not going to give you any specific medical advice. If you're sick, you definitely want to consult your healthcare provider. I'll have more on that a little bit later on in this video. I got all the information I've included from a number of trusted sources, including the Centers for Disease Control and Prevention, the World Health Organization, Oregon's Health and Science University, as well as the White House Coronavirus Guidelines for America. I'll link to all of those sites in the description below so you can access them if you need more information. Additionally, I'm going to provide a few actual numbers, but not many. The situation is fluid and changing constantly, and I want the info I provide to be as accurate and up-to-date as possible, no matter when you actually watch the video. Here's what we know as of right now. There are, as I write this script, over 197,000 reported cases worldwide, with 7,951 deaths reported. Of the total number of cases, over 81,600 people have recovered and been discharged from the hospital or been allowed to go back into society without being quarantined. That's the good news. Of the 100,000 plus current cases, just over 7,000 of those are considered critical. Again, these numbers are guaranteed to change, so just keep that in mind. This is what the World Health Organization says about the virus.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow, or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Since the World Health Organization recommends washing your hands to rid the virus from your skin, here's how they recommend washing your hands.
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
The Centers for Disease Control and Prevention also says this about the virus in addition to what the WHO has said. There is currently no vaccine to prevent the coronavirus or COVID-19 disease. The best way to prevent illness is to avoid being exposed to the virus. If soap and water are not readily available to wash your hands, use hand sanitizer that contains at least 70% alcohol. Cover all surfaces of the hands and rub them together until they feel dry. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. I'll have more on that in just a moment. In order to protect the health and safety of other people, you should stay home if you're sick, except to get medical care because you can have the virus and spread it around even if you're not showing specific symptoms. If you are sick, you should wear a face mask when you are around other people, sharing a room, for example, or in a vehicle driving somewhere, and before you enter a healthcare provider's office, and that's very important. If you are not able to wear a face mask, for example, because it causes you trouble breathing, then you should do your best to cover your coughs and sneezes, and people who are caring for you should be the ones to wear a face mask if they enter your room. If you are not currently sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask themselves. Face masks may be in short supply for a while, and they should be saved for caregivers because they need them the most or the very sick. Regarding cleaning surfaces, in order to disinfect surfaces that may be infected, if you are running low on cleaning supplies, try diluting household bleach. To make a bleach solution, mix 5 tablespoons or 1/3 of a cup of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. Follow the manufacturer's instructions for application and proper ventilations when you're using bleach. Check to ensure that the product is not past its expiration date. And never ever mix household bleach with ammonia or any other cleanser. If you mix it with ammonia, you're actually making mustard gas, so you do not want to do that. Unexpired household bleach will be effective against coronaviruses when properly diluted. Now, who is most at risk? Early information out of China, where the COVID-19 or novel coronavirus first started, shows that some people are at higher risk of getting very sick from the illness. This includes older adults, say over 60 or so. People who have serious chronic medical conditions like heart disease, diabetes, lung disease, and others. During a COVID-19 outbreak in your community, stay home as much as possible to further reduce your risk of being exposed. Contact your healthcare provider to ask about obtaining extra necessary medications to have on hand in case there is an outbreak of COVID-19 in your community and you need to stay at home for a prolonged period of time. If you cannot get extra medications, consider using mail-order medications online so that way you don't have to leave the house to get them. Be sure you have over-the-counter medicines and medical supplies, such as tissues and so forth, to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. If you are sick with COVID-19 or suspect you are infected with the virus that causes COVID-19, you should take steps to help prevent the disease from spreading to people in your home and community. If you think you have been exposed to COVID-19 and develop a fever and symptoms, such as a cough or difficulty breathing, call your healthcare provider for medical advice. Otherwise, you should stay home. People who are mildly ill with coronavirus or COVID-19 are able to recover at home. Do not leave except to get medical care. Definitely do not visit public areas. Stay in touch with your doctor. Call before you get medical care. Get care if you feel worse or think that there is an emergency. Very important, you should avoid public transportation, as well as other things like ride sharing, taxis, that sort of thing. Try to get there on your own if you can, or have someone take you with the least number of people in the car that you can to avoid exposing too many people to the virus. Separate yourself from other people in your own home. This is known as isolation. You should be in what's known as a sick room and away from the other people in your home to avoid exposing them. Use a separate bathroom if it's available as well, only for the sick person. You definitely want to restrict the contact with your pets and other animals just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people with the virus limit contact with animals until more information is known, because you could make your pet sick, or the virus could maybe live on their fur, and then if someone else pets them, they then have the virus on their hands and could be exposed and get sick too. Whenever possible, have another member of your household care for your animals while you are sick with coronavirus. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with them to help avoid spreading the virus or making them sick. If you have a medical appointment, call your doctor's office or emergency department and tell them you have or may have COVID-19. This will help the office to protect themselves and other patients as well. Now, if you are actually sick, you should wear a face mask when you are around other people and before you enter a healthcare provider's office. If you are caring for other people, remember that if the person who is sick is not able to wear a face mask, for example because it causes them trouble breathing, then people who live in the home should stay in a different room. When caregivers enter the room of a sick person, they should be wearing a face mask. Visitors other than caregivers are not recommended while a person is sick. You should always avoid sharing personal household items. You don't want to share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home if someone is sick or has been exposed. After the sick person uses these items, such as dishes and so forth, wash them thoroughly with soap and water or put them in the dishwasher to get rid of the virus from those things. It's very important that you monitor your symptoms. You want to seek medical care right away if your illness is worsening. For example, if you have trouble breathing because it's a respiratory disease that can lead to pneumonia, so you don't want to have trouble breathing. You want to make sure to remember to call your doctor before going in to either the doctor's office or the emergency room. You want to call ahead and tell them your symptoms, and they will tell you what to do. That's very important. If you do go to the doctor, put on a face mask before you enter the building if you can. If you can't put on a face mask, try to keep a safe distance from other people, which is at least 6 feet or 2 meters away from other people. This will help protect the people in the office or the waiting room from getting exposed. You definitely want to follow any care instructions from your healthcare provider and local health department in your community or state. Your local health authorities will give instructions on checking your symptoms and other information that you need to tell healthcare providers should you get sick to avoid exposure of other people. In the United States, where I am, you want to call 911 if you have a medical emergency. Now, if you do have to call 911 because of a medical emergency, notify the operator that you have or think that you might have coronavirus or COVID-19. If possible, put on a face mask before medical help arrives to avoid exposing the emergency service workers who come to help you. Regarding getting better, how do you know when to discontinue your home isolation? People with novel coronavirus or COVID-19 who have stayed at home or have been home isolated can stop their home isolation under the following conditions. This is according to the CDC. If you will not have a test to determine if you are still contagious, you can leave home after these 3 things have happened. Number 1 is you've had no fever for at least 72 hours. That's 3 full days of no fever without the use of any medicine that actually reduces fever. And your other symptoms have improved. For example, you have less coughs or shortness of breath. And the third one is at least 7 days have passed since your symptoms first appeared. If you will be tested to determine if you are still contagious, you can leave home after these 3 conditions have happened. You no longer have a fever without the use of medicine that reduces fever, and other symptoms have improved. For example, you cough less or you have less shortness of breath. And number 3 is you receive 2 negative tests in a row 24 hours apart. Your doctor will follow CDC guidelines on administering the test and getting you the results. In all cases, follow the guidance of your healthcare provider and local health department. The decision to stop home isolation should be made in consultation with your healthcare provider and state and local health departments. Local decisions depend upon local circumstances where you happen to be living at the time when you are sick and whether or not there's an outbreak in your larger area. There is much more information on the websites I've listed in the description below. It's current, important, and it can save your life, so look it up. With all of this said, there is hope. The chances of you getting sick are probably pretty low overall, and if you do get sick, your chances of a full recovery are also very good. While health organizations suggest social distancing, which means keeping at least 6 feet or 2 meters apart from other people to stay safe, I think it would be better called physical distancing because we need to stay together and connected to others to get through this, even if you must remain physically apart from one another. If you're alone at home and want to stay safe, but also connected, consider staying in touch with those you love. Call them, you can FaceTime them if you have an iPhone, or Skype with them. You can learn how to Skype with others if you don't know how to do it in a video that I did a while back, and I'll link to that video in the description below so you can start staying in touch with your family right away. Personally, I'm optimistic. I know that if we work together as a people and as human beings, we can all get through this. If you have any specific virus questions, refer to the websites that I've listed in the description below, because those come from qualified healthcare providers. Be well, and I'll be returning to my regular video blog schedule soon.